Hi guys, welcome back.
Welcome back.
This week we wanted to talk about something that we actually get a lot of questions on, which is our vitamin shots. So a lot of people have seen this flyer kind of floating around about our vitamin shots. We've had them for a couple years now, but we really haven't done a lot of education on them. So we want to take this time.
And I think there's been a lot more questions recently because we've just added a couple other things to it. So we have our faithfuls that are they're regimented. They come in consistently for their vitamin shots. They swear by them.
Yes.
And then there's a lot of other people that kind of want to dabble in and say, hey, does this really work? Does it not? So we want to just take a little bit of time to kind of go over a couple of the different options and let you know which one maybe you want to try, which one might be, like, what issues you might be dealing with that these vitamin shots can benefit. But.
Yeah, and so traditionally we've had three, which kind of center around the B vitamins. So we have the Skinny B12, we have the B complex, which has B12 plus other B vitamins, and then we have our Lipovite, which has 12 vitamins in it, including some of the B vitamins as well.
And it's got lipotropics. So the lipotropic shot that we carry is the Lipovite, and so that's got B12 plus these essential amino acids that are a little bit more like fat burners. So they're going to help with a little bit of liver detox, take some of the fat off the liver, help your body kind of process your fat. So we see that more so for patients who are maybe trying to lose a little bit of a weight, but also have some, like, a little bit of energy boost.
A lot of our weight loss clients will actually use it. So let's say they're hitting like a little bit of a plateau in their weight loss, and they add on that Lipovite shot to help kind of push them past that plateau. So it's very popular. I would say it's our most popular of the vitamin shots.
Yeah, because you're getting a little bit more bang for buck out of it. It also depends on how you do it. So if someone comes in and says, I'm going to do one shot and I'll tell you next month how I feel. I mean, really, that's not going to do much for you. So we always talk about doing a loading dose and then doing a maintenance, right? And so often a lot of these shots are you're coming in once a week for about 5 weeks, and then you can go once a month, or some patients will do once a week for 10 weeks and then go once a month. So it really depends. It's very variable based on the patient and what's going on in your life. I know a lot of times patients who during the winter months will come in more regularly just because they want to, like, enhance a little bit of their immunity. You're fighting off a lot of those common colds and you're exposed to a lot more of those bugs. So that sometimes helps. And then we just recently added something called NAD plus shots, which you've probably seen it, or now that we're talking about it, it will probably start coming up on your feeds. But NAD plus has been around. The easiest way to describe it is it's something that it's an enzyme that we already are producing, and it's used for cellular metabolism and recovery. A lot of times the big buzz with it is it's kind of like an anti-aging shot. It helps us with giving us more energy, more clarity, that fogginess. I always say your winter blues, you're kind of like in this little rut. It's going to help kind of get you out of it. I started taking them. I love them. I mean, you definitely notice it within, I would say, like 15 to 30 minutes of taking the shot, and then it lasts for about 3 to 5 days. So the recommendation for that shot is you're going to be doing it once a week, again for 5, and then you go once a month thereafter.
Yeah, definitely a buzzword. NAD plus is buzzing all over Instagram and social media for sure. So we just got that one on board, and we're excited about it. Dr. Thomas thinks it helps him focus.
Yeah,
so.
Well, and
we need that.
Everyone says I'm always running around, so it does. But I mean, everyone's different. I mean, you can also do NAD plus with B12, and that's a lot of times our patients do that as well. So the easiest way is to say, like, what is it really that bothers you? Are you having trouble sleeping? Are you having trouble with energy? Are you having trouble with a little bit of weight gain? Is it more focus, mental clarity? Is it recovery? So NAD plus can also be used if you're training, if you're working out a lot, because again, it's all cellular, like recovery and cellular metabolism. So it's going to help in that process.
Yeah. And then, like I said, we also have B12 and B complex, which we've had for a long time. B12 is kind of like the lowest tier. It only has the B12 in it, but if all you're looking for is a little bit of an energy boost, B12 is good for that.
Yeah.
B complex helps with energy as well, but then also helps with hair, skin, and nails as well. And then, like we already talked about, Lipovite helps with the fat, and then NAD plus helps with the
anti-aging and mental clarity.
Mental clarity for sure.
And
all of our shots
energy.
All of our shots are also we sell in packages, so buy 4 get 1 free.
Yeah, so the NAD is basically $60 for one shot, or if you buy 4 shots, you get 1 free, which would come out to be $250. Or you could buy 9 and get 3 free. And so that averages out to $40 a shot. So just basically, we know that you're going to be doing it. And so, and it's not a one and done typically. So just giving you guys a little bit of a discount for buying, the package is how we do it. We also do that for B12. We also do that for the B complex as well as the Lipovite.
Yes. So hopefully this gives you a little bit of clarity on these vitamin shots, and we hope to see you guys soon.
Yeah.
Thanks.
Thanks, guys.